Welcome to the VET S.O.S podcast. Remember, don't drown the sea of transition. Grab the VET S.O.S Lifeline. Today, we're sitting down with Terry Vance, Veterans Partnership Coordinator for Valley Healthcare Systems Veteran Program. This conversation is going to highlight what is possible when you bring veteran organizations together for a common good. Can't wait to jump into this one. There's a lot of good things going on out there in his neck of the woods. So we're back from the future with our souped-up DeLorean. How you doing today, Keith?
I'm doing well, Shawn. Again, I don't know how I'm going to respond, but I will just say, as long as we keep recording the podcast, keep it fresh, and keep the flux capacitor fully charged, the future's looking pretty bright. How's that
There
one?
you go. You got to keep the
Yeah.
flux capacitor charged.
How you doing, Shawn? I haven't asked you that.
I'm doing well. I got this bandage on my nose, make it look like I'm
I
a
noticed that.
badass, fighting all over the place. But truth be told, my CPAP mask is kicking my butt while I sleep. So it's nothing that glorious.
Nice.
All right. So we got Terry Vance. He's a United States Air Force veteran and currently serves as the Veterans Partnership Coordinator for Valley Healthcare Systems Veterans Program. In this role, he's been instrumental in building a strong network of support for veterans across the region, establishing a coalition of more than 100 organizations through memorandums of understanding and strategic partnerships. With over a decade dedicated to serving veterans in need, Terry's work reflects his deep commitment to ensuring that those who have served our country receive the care, resources, and respect they deserve. A graduate of Marshall University, Terry served the U.S. Air Force as a medical service specialist before transitioning to a civilian career in veteran advocacy and support services. Terry is married to Lori, and together they are proud parents of their daughter, Caitlin. And Terry is the owner of Hair Mechanics, a men's barber shop and salon located in Morgantown. How you doing today, Terry?
I'm doing fantastic, Shawn. Great to be here.
Man, that is fantastic. And, this is great timing because on the last episode, Keith was talking about needing a haircut. So, this is like a partnership made in heaven right here.
Keith reminds me of he's got the Duck Dynasty look going on.
I just don't have the money going on. That money part would be a lot nicer to have, too.
You make it down this way, Keith. We'll take care of you for free.
Nice. Okay. Yeah, my normal barber charges like $50 a pop, so that'd be good. I go through there every now and again. I got a lot of I live in Virginia Beach, so I got a lot of family out west. And I-64 every time I'm going to visit somebody, right on through West Virginia. Yep.
That's fantastic. All right, so Terry, tell us about your transition, man. How'd that go leaving the Air Force?
Well, like I said, like everybody else, you're super young when you go in the military. At least I was right out of high school. I wasn't like a big scholar in high school. I was boxing. I was playing basketball, but I had some buddies that went into the Air Force, and they kind of talked me into doing that. And my dad was he was a Vietnam vet, Army veteran, so he thought it was a great idea. And surprisingly to me, I scored well on the ASVAB. And so like I said, I wasn't a scholar in high school. I was trying to get out of any hard class I could take, and take as many gym classes as I wanted. But that didn't work out too well, as the counselor pulled me in and started putting me in all these other classes. But I went in as I chose a career of medical service specialist, and for me, that worked out fantastic. So Air Force, obviously, out of all the branches, the basic training is very short. It's like 6 weeks at Lackland Air Force Base. Then I went to Wichita Falls, Texas for my technical school. And then I went to Eglin Air Force Base for clinical. And then I got extremely lucky because I got stationed at Wright-Patterson Air Force Base, which is about a little over 3 hours from Huntington, West Virginia, where I was from. So I could actually drive home, on the weekends. After about a couple years in, then the first Gulf War broke out. And I got sent over to, it was a British Air Force base called Little Rissington. And actually, for whatever reason, I started doing a little research on that recently, and started finding some like really cool looking badges that they have. And I don't know where to get, where I could find those because it's a long time ago, but I'd like to get some of those and get them framed. But went to Little Rissington. At the time, we built the largest, I still think it stands. We built the largest contingency hospital during wartime. It was a 1,500 bed contingency hospital. They did have, if you look at the history on that, Little Risley was at the top. They did 3 locations during that Gulf War: Germany, England, and Spain were the 3 places where they set up individual hospital places where they could fly air vac patients over. And we just happened to have the largest at the time. And so as a young man, it was fantastic, getting to go overseas. My parents cried when I went over there and I said goodbye to them. But fortunately, I never had a shot fired at me. They had some terrorist attacks downtown England while I was over there. The bad thing is that when you go in during wartime, you get wartime pay. You get you get all these extra. You get a per diem. When I was there, right when I left, they started right before I left, they started having these like terrorist attacks down on the subways in England. So you got terrorist pay. Then they raised the per diem from $26 to like $50 right on the day that I left, and I was like, "You've got to be kidding me!" But I was offered a air traffic controller's position when I was getting ready to leave the Air Force, and I really wanted to go to school. So I decided to, for me at the time, it was the right thing to do. I wanted to go to college. Went to Marshall University, got my degree. Thought I was going to be, got an English degree, secondary education. Thought I'd be a teacher. I was coaching girls basketball. That's what I love to do. I said, that's what I'm going to do in the summertime because the teachers get off during the summer. And my wife worked for State Farm. Lo and behold, 17 years later, I was, I had a career at State Farm for 17 years. Um, it wasn't until we moved to Morgantown, where my wife's a State Farm agent, that I started getting into the veteran side of things. When we moved up here in 2011, started volunteering for a nonprofit, and just really loved it. And the state of West Virginia, Workforce West Virginia, which I'm sure they have a workforce. It used to be called unemployment, but now they call it workforce. I'm sure they have that in every state. They have what's called a DVOPS position, which is a Disabled Veterans Outreach Program Specialist, and they also have a leaver, which is a local veterans employment rep. And one works with the veteran in case management, and the other one works with the employers. And I actually transitioned from one to the other, then went to work for a nonprofit as a program manager, and then Valley Healthcare, the CEO. I don't know. I did the guy, Governor Morrissey, who's the governor now. He was actually a congressman at the time. Wanted help setting up a just a round table at WVU, a talk, and they called me and they said, Terry, every place that we call across the state, we're trying to get these veteran organizations involved. Your name comes up more than anybody else's. Can you help us put this together? And I said, absolutely. So we got that together. And the CEO here, I don't know if he saw me on the news or with the paper, I don't know what, but he wanted me to be part of the team over here. They had a small coalition. I wouldn't even call it a coalition. It was like 6 organizations at that. Um, and he said, I'd like to have a partnership with the National Guard. I'd like to have a partnership with Workforce West Virginia. I'd like to have a partnership with the local, WVU, which is the big entity here in Morgantown. It's a college town. And I looked at him and I said, done, done, and done. I said, what else? And he goes, if you can make that happen. So in a year and a half, we went from 6 organizations to where now we have over 100 organizations in our coalition. And the one thing about, like you had asked me before we got started, Shawn, is what was the name of the coalition? The name of the coalition is just a veteran coalition. And the reason for that is, we have the meetings here at Valley, but I don't like to designate the coalition under the umbrella of Valley because it's really not. Every organization that joins the coalition, it's their coalition. No entity is more important than another entity. So that's why it has the generic name. Now, we meet every Thursday, second Thursday of the month, from 12 to 1. I tell you the key to, if you have a meeting with different organizations, anybody, provide lunch. You'll always get a good turnout if you provide lunch. And we have a fantastic cook here at Valley because we have residential services at another location. And she comes up and provides the meals. Fantastic. Other key to a great meeting, always have a guest speaker. I can't tell you, after doing this for 10 years and being at every Family Resource Network meeting, Veterans Resource, you go to all these different things and it's kind of the same format. You go to a meeting, everybody sits around a circle, and you show up at the meeting and they're like, can you tell us who you are and what organization you're with, and do you have anything coming up? All right. I show up the first time I do that. Now I show up the second meeting, the third meeting, the fourth meeting, and we're doing the same format. I'm like, at that point, I'm like, listen, I know everybody in the damn meeting. I don't need to hear you introduce yourself 5 times, in 5 months. Doesn't make any sense. And that's why a lot of those meetings taper off. They don't hold, their substance. They don't, they can't hold it together. One thing that I offered with the coalition is you don't have to be 100% veteran affiliated. Now, do we have organizations that strictly provide veteran services, and that's pretty much it? Yes. You got the VA, you got the Marine Corps League, the VFW, the American Legion, Veterans Upward Bound, ActiVet. There's, I can give you a whole list in our coalition that are just veteran affiliated. Then you have organizations that provide veteran services, but they also provide services to the public. So you might have somebody like Huntington Bank that's not a veteran organization, but they have a veteran loan service, or they provide some type of service under the bank umbrella that's specifically tailored towards veterans. Then you have a company or a business entity that doesn't offer anything specific to veterans, but they service the public. Well, if you're servicing the public, you're servicing veterans. You're just not aware of how many veterans are coming into your business, and it educates them. And then a lot of these businesses create some type of program or a discount on their services. So that's how that goes. I'll let you guys jump in because I could talk forever.
Well, I mean, the show's all about you anyway. So
Yeah, you guys are you're like Jiminy Christmas. This guy, he's not going to shut up.
no, it's good
I
stuff.
love it. I love it.
So I'm kind of curious more about the Veteran Coalition. Like, what is the? I mean, I get the purpose, but like, what is the end state? Like, what's the kind of where are y'all going?
Okay, so with the coalition, like I told you, I said we always have a guest speaker. The guest speakers, by 99.9% of the time, come from the coalition itself. It gives organizations the opportunity to talk to other organizations about their services. So we also have a Zoom option during the meetings. So we average probably 35, 40 organizations that show up per meeting, and then we may have another 15 or 20 that show up on Zoom. Every month is different because, people can't make every meeting, and there's no requirement for that. But it also provides a network of sharing. And it's not just by attending the meetings. Let's say, Keith, that you have a business or an organization and you guys are putting on an event, and you created a flyer. Well, you could put that flyer out in your business. You could maybe put it out, and share it with somebody. Now you're part of this coalition. We're able to now email that out to over 100 different organizations. That's all free marketing for these, for everybody. Now think about it. Every business or organization that's part of the coalition, they're all different sizes. You might have one that may only have 5 employees, 10 employees. Then you go to something on the larger side of scale, things like WVU University. They have thousands of employees. WVU Medicine, Mon Health, the Red Cross, United Way, thousands of employees. So now you get these flyers that get distributed into their, they take them, they share them in their break rooms, they share them under their email threads. Now that event becomes widespread. It gains you recognition. So we want to share, each other's information. That's the big thing. I always harp on people and I've done this for so long. I've learned that, look, nobody's going to come and knock on your door. It's just not going to happen. If you want to get the word out on what you're doing, you've got to go knock on other people's doors. I put a 9/11 event on this year, and I did it all by myself. And I had over 60 organizations there. I had the VFW, the American Legion, and the Marine Corps League. They put on the flag ceremony. I'd I'll go out on a limb and say that's the first time that's ever happened in our country. If you take the specific day of 9/11, that all three of those organizations work together to do a flag ceremony. I've never seen it happen. Usually they do something on their own. Maybe somewhere two of them work together, but to have all three, that's pretty special. We had a bald eagle there. We had the WVU Mountaineer. We had veteran-owned food trucks. Yeah, I mean everything tailored to and it was veteran and first responder oriented. We had fire trucks. We had the police. We had everything. So it's really special. We had even down to the national anthem. I had a gentleman from the Veterans with Guitar program through the VA that did the national anthem in the old Jimi Hendrix style. We had Woodman Life Insurance bring a 30 by 60 American flag that, that we displayed out on the field in the grassy area. Senator Justice couldn't make it, but he sent a representative to, come down and read some words. Next year is the 25th anniversary, so I'm going to do it again. We're going to do it bigger and better. But the key to like this coalition, going back to your question, is what all do we do? One is we network, we provide services to veterans. So now, when a veteran calls me, I'm almost like a one-stop service. I've got, where I worked for the state of West Virginia, I already have a Rolodex of over 500 employers across the state that I can connect them with employment opportunities. But now I have all these other services that I can offer them. I don't offer all those services, and I don't claim to offer all those services. But if you're a veteran and you come to me, now here at Valley, we also have the DAV that comes in, and we've allowed them to set up office. They come in several times a month and help veterans with their claims. And now they have the opportunity, if they have mental health issues or substance abuse problems, they're in a facility already that they can easily sign up, fill out an intake form, and get treatment and assistance, for whatever need they have. So that's the big thing that we do with the coalition. We also do a walk the following day at the Botanic Garden. That's open to not just the veterans, it's open to public. So anybody that wants to join, we just go for a walk. And then we can feature an organization, or we could just talk. We can talk football. We could talk. About your podcast. We can talk about whatever we want to. What spins off of that coalition is a lot of great things. So I talked about the 9/11 event. That having 60 organizations there, that's possible because of my connections with the coalition and with the community. The key to my success is I don't make this about me. You'll never hear me say when I go to a partner, hey, I'd like for you to help me with this. I'd like for you to, I make it about the partner. There's nothing that brings me more joy than what I can do for you, not what you can do for me. What can I do for you? Because if I can do something for you, in return, you're going to be doing something for veterans. That's all I care about. So to give you an example, I had this vision last year that's like, you know what? And a lot of people were doing this. I'd like to do a coffee, veteran social hour. So starting next week, we're doing a veteran social hour at Starbucks. They've offered to donate coffee. I joined forces with United Way. And so we get that kind of family resource network connection as well. It says social hour. It's actually from 7:30 to 9. So it's not really it's an hour and a half. But we're doing that. I went to, before the 9/11 event, and this is what I'm telling you about, you've got to go out and you've got to knock on doors and you've got to make things happen. Media coverage is expensive. If you want to advertise something on the media, radio, television, that's not cheap. And they don't want to give it to you for free. If you notice, if they don't have anything going on, they'll come out and cover your story. And it's usually they come out and cover it the day that it's happening, and then they report the story the following day. Well, what the hell does that, my point with that is that if I'm having a rummage sale on Saturday, why the hell would I want to, put it out to the public in the Sunday paper the following day. It doesn't make any sense. And that's what what I tell the media. I'm like, look, I don't need for you to come out the day of the event. I don't need for you to report the story the day after. I need for you to promo this event the week before, 2 weeks before, and then cover the event and then cover it after. So I went to WBOY TV. I went to WD TV. I went to WAJR Radio. I went to the Dominion Post, the paper. I didn't email them. I didn't call them. I showed up in person, and I gave them this was basically my pitch. I'm like, you can either be a part of this, or you don't have to be a part of it. It's up to you. But this is something for the community. It's for first responders. It's for veterans. Do you want to be a part of this? Every one of them said yes. They all had promos with me on television. They all came and covered the event. They all ran stories after the event. The Dominion Post ran a full front page article on the paper the week before, full page article the day after. And it was fantastic. WAJR. But then what I did is afterwards, I sent everybody that came to the event that set up a table, they all got a thank you. I also went to these news organizations. I sent them thank yous, and I showed up in person. And one reason I showed up in person, because my mind, as you can tell, it goes 100 miles a minute. I had an idea when I was over at WAJR Radio, and the interview I did, or the promo I did, was with Mike Nolting on the Talk of the Town for WAJR Radio. And my mind went, man, wouldn't it be great if he did a month? Just, I'm not asking him to do it weekly, daily. If he would do a monthly spotlight on veterans, and we could talk about veteran organizations, we could talk about, we could bring veterans in studio, we could talk about events, news, whatever it might be. So I pitched it to him. I didn't realize Mike was a veteran. He loved it. So this week on Monday, I was in Mike's studio, and we were promoting this new show that's going to start on November 5th. He's going to have his first guest. My idea for the first guest was the Marine Corps League. They have their 250th birthday coming up. They're having a Marine Corps ball at the Lakeview Resort here, and they're also doing a Toys for Tot drive in the city of Morgantown. Great, perfect guess. But there's we have part of our coalition. Here's a company called or a nonprofit called Mission Believe. The guy works with honeybees, but then he has another nonprofit that's called Initiative 22, and that they work with cannabis, and that's a little controversial, to some people, but in some realms, veterans that use that in a medical fashion, it can prevent them from committing suicide. So if it saves a life, I'm all for it. I just reconnected with this gentleman here. Veterans, it's Commemorate Through Cords. You go to this guy's website. It's fantastic. I used to work with him at Workforce West Virginia, and now he started a nonprofit where he takes veteran songs or stories and turns them into song. So, it's guys like that, women like that you run across, and they're giving back. He doesn't charge anything for that. That's the people I like to work with, and that's that's what makes it special. I'll let you guys talk. I'm going all over the place here.
No, man.
It's all good. It's all good. We've had Sergeant Major of the Army on here. We've had Rangers. We've had, people. We've had all kinds of people on here. It took us bringing on an Air Force guy to have a picture of an MRE in the back.
Oh, yeah.
I love it. I love it. Oh, man. So, hey, Keith, man, it's about that time.
I keep MREs. I've got, even though I'm an Air Force guy, I treat them all the same.
Nice.
They make fun of me. Don't get me wrong. The Marines, the Army, my guy that I work with, he's an Army guy, infantry. Makes fun, and then I have an open door policy. So we have about 50 or 60 veterans that we treat here at Valley, and open door policy. They go do some treatment with, we have 2 veteran therapists on staff, And I have an open door policy. They want to stop in anytime after their sessions, during the breaks. They could pop in. We could talk whatever they want to talk about. Sometimes we just talk about football, or they just come in here to bust my balls about me being in the Air Force, which is fun. I always tell them, like, I'm like, look, just because you weren't smart enough to be in the Air Force, and I'll try to throw some shade back to them. It doesn't work too well. But I tell them, I said, look, when you were down on the front lines and those bullets started coming down heavy on you, I said, you're hunkered down on that radio. You're like, we need air cover. We need air cover. I said, that's when the Air Force came flying in over there. So I always try to throw something back. I don't have a whole lot of ammunition to throw back at them, but it's all,
No
yeah,
pun
it's all
intended.
fun.
Yeah.
Yeah, it's all fun.
All right. So, Terry, it has been great having you on the show. We are at time, unfortunately, though. So I do have two questions.
Yes,
The
sir.
first one is not related to veterans at all, but what in the world are you guys going to win a game this year? And then second of all, sorry, had to throw a little bit of shade on the football front. I'm a
Oh, they're
Kansas
doing
State
terrible.
fan. I'm a Kansas State fan. Go Cats! But yeah, are you going to win a game? And two, how do people get in touch with you? How do they reach out to you to either join the coalition or learn more about the Valley Healthcare Systems Veterans Program?
I'll give you the contact first. My email is the letter T, the letter E, Vance, VANCE, at valleyhealthcare.org. And they tell people that, hey, don't give out your number. I have an office phone number, but I work off of my cell, my personal cell, and that's the number I give out. I was in Florida for Universal. I pick, on vacation, I pick up my phone. I had a veteran reach out there, 304-710-9291. If you're interested in the coalition, if you're interested in just anything, you can give me a buzz. And as far as the football team goes, Keith, they suck. I mean, they suck ass. They're not going to win a damn game. These people that go sit in the cold weather are crazier than hell. And look, I get shade. I don't let too many people know I went to Marshall, because up here in Morgantown, they hate Marshall. And down in Huntington, they hate WVU.
Yeah.
So, it's, I wear this up here so I don't get my ass
the enemy.
kicked. Yeah. So I can't walk around with Marshall gear. But yeah, they're terrible. They're not going to win a game. I mean, come on now.
That's hilarious.
I probably, hopefully I don't lose any business in my barbershop because of that comment.
No, I don't think so. No, it's pretty evident right now. That's
but
why I'm a Big 12 guy, so yeah,
they'll get better.
Keeping track. They will. Y'all used to be, well, yeah. Back in the day, you were rock stars, but you'll come back around.
All right. That's the mistake of joining the Big 12.
Yeah. I won't go there, but yeah. All right, y'all. So, again, Terry, thanks for coming on. And on behalf of the entire VET S.O.S family, we want to thank everyone for spending their time with us today. It's always great having everyone along for the ride. Don't forget to check out all of our other episodes and keep coming back for more stories, insight, and support from the VET S.O.S crew. If you enjoyed this episode, give us a follow, share the show, and tell a friend or two. Toss your battle buddies, fire team, shipmates, and wingmen that flotation device that they might need in their transition so no one drowns in the sea of transition, and grab the VET S.O.S lifeline.
Yeah.